Is it that they should not allow the corpse to be brought in, or they have to determine the cause of death? Because, I mean, yes, it's unfortunate this case has broken out, but families have got to attend to maybe the burial rites of their loved ones.
Well, the truth is that to every rule, there will be exception, but they have to have, like you said, a proper medical certificate of death. But generally, we have told custom, so you now have to prove. We are working with custom, we are working with the airline operators. Where you can make your case, then we approve. But we want to maintain a tight control over the body. For instance, in Anambra, where we are told the body was brought in, we have already gone there and working with the Anambra state government. We have taken samples for analysis. Once the result comes out, we will then move on and we'll let the public know. In Imo, the case reported in Imo has already been decided because they had a proper medical certificate of death. So now we have said the body can be buried. It's not Ebola. And then yesterday, we sent a team to Akwa Ibom to begin investigating a case of a cause that was brought in from one of these countries, reported to us. So 24 hours, we are on our toes and we are working.
With all the efforts you've highlighted, one begins to wonder, do we have the institutions on ground, infrastructure on ground to manage this situation?
Well, that is one area, I must say, we are a little bit slower than what we anticipated. For now, the priority is in Lagos. The Lagos state government has done well. They have provided a place for us to quarantine and treat patients, and we are still asking for more. Given the way Lagos state has been very proactive in this matter, I want to commend the authorities of Lagos state. I believe, still working with them, they will be able to provide additional spaces. On our own part, using our tertiary health institutions, we want to move ahead and provide what we call isolation tents, even within our hospitals, so that we can also add on to what the states are providing. Then we have trained the workers, and they need to be trained properly. Personal protective equipment is being provided both from us as federal government and also through our development partners, especially the World Health Organization. But the other states were a bit slow, but we want to move things fast because we have an emergency on our hands. We cannot wait to be surprised in those states. And quite a number of governors are beginning to cooperate, I must tell you. So that's one area I think as Minister of Health we really need to move a lot faster.
But how fast can you move? What are the plans to ensure that this you speed up the provision of this infrastructure?
Even as I leave the studio, I'm working. In the past 2 weeks, I've hardly slept before 4 a.m. So we are working. I can assure you, and the governors now are beginning to cooperate. Once in a while, you run into problems. We're also running into problems in some states where once a local government chairman or a traditional ruler hears that we have selected a facility within their domain, for isolation, they begin to, incite the youth and begin to say, we don't want Ebola in our community. This has happened in other countries, but we want to enlighten people, want to appeal to everybody to cooperate with us. The people need to understand that all of us are at risk, and anyone could actually need that facility. There's no person that has his passport written, your name is Ebola virus disease. Nobody. All of us are potential candidates, and therefore all of us must collectively do things that would ensure our collective safety and our individual safety. And we're appealing to the media to help us also to continue to persuade people to understand what we're doing.
All right, part of the fear or questions that people are asking at the moment as they're watching and tweeting about is the family of the female doctor, those who she may have been in contact with, especially on the first day. Are they safe? Are they also being, are they under watch or surveillance?
They're under surveillance.
Okay, I was talking about the families of or the persons that the female doctor who is now tested positive to this virus, those who she was in contact with on the first day when she treated the Liberian. Are they safe? Are they also under watch? Any cause for concern at the moment?
They're under watch, they're under surveillance. None of them yet has been symptomatic to the best of my knowledge, but any of them that gets symptomatic will also be quarantined. We're also counseling them. They need to be counseled at this stage. It's not an easy thing. Everybody needs counseling, even the health workers who are attending to patients. They need to be counseled. The families of those who are primary contacts, they need to be counseled, and we're doing our best in that regard.
What could possibly be done about that, for instance?
Well, for that, like I said, I think that interview was even held before the first case came into the country. So we've been talking about it. But regarding people's eating habits, it's very difficult to just say outright ban. Even when you ban it, people go underground, and it's even worse because you are not monitoring them. But I think what is needed is information. I do know people who have seen me just either at the airport or they just see me at a ceremony and say, Honorable Minister, since that day you talked about bats, I used to eat bats, but I've stopped. So it means that it's possible. The more we talk to people about the dangers of certain practices, they can change. But there's no guarantee that everybody is going to heed your advice and change immediately. But let me make this point now. It is more dangerous for those who actually process the meat. Because for those who are just eating it, if it's actually thoroughly well cooked, then the danger is over. But those who are still preparing the meat when it's raw are more in danger. So the best thing is just to avoid some of these animals completely. Since we have other meat that we can take goat meat, mutton, and so on. I don't think we have to eat chimpanzees. I don't think we must eat monkeys. If you love birds, and right now we don't have avian flu, we can go for chicken. Must it be, someone having to go for bats? So what is needed is enlightenment, appeal, and the right information. I believe we'll get through.
Well, Prof, we can't let you go without, asking you this particular question as to how the current doctors' strike is also affecting your drive to ensure that, this disease doesn't spread.
Well, I don't know how to look at it. Ordinarily, if doctors are not at their stations, then we have a major challenge. But some other people, I've read some of the articles in newspapers. I see some other experts suggesting that part of the reason why we were able to get through where we are today, especially within this case successfully, was because doctors were on strike in public health institutions. Because if they were working, they could have been taken to a less than ready institution. I don't know how that is true, but people are looking at it from various angles. But as Minister of Health, certainly I feel that we have a disadvantage now that doctors are on strike in public health hospitals. But so far, it has not affected what we are doing on Ebola. I can assure you it has not. But certainly, if we begin to have more cases, which is possible, but we're doing everything to contain it, but we must be honest, just like I told channels even before we had the first outbreak, that we are at risk. I'm not missing words about it. Then certainly we need to continue to appeal to the doctors to come back to work. And I'm still using this opportunity to appeal to my colleagues, because I'm a medical doctor, that they should come back to work, especially now that government has addressed virtually every of their concerns. Time it is now for them to come and help fellow Nigerians.